L-glutamine can help to improve alertness, concentration, focus, memory, and mood, boost human growth hormone, and reduce anxiety. L-glutamine is a conditionally essential amino acid and a main precursor for the production of the neurotransmitter glutamate and GABA in your brain. Glutamine is the most abundant amino acid in your body, and it's involved in many of your bodily functions, including much of the activity in your brain. But L-glutamate is the most abundant amino acid in your brain, and the balance of these two is critical for optimal brain function. The function of the glutamine to glutamate cycle is involved in protein synthesis, precursors for muscle growth, regulation of the acid-base balance in your kidneys, provides oxidative fuel for your intestines and your immune system cells, provides nitrogen transport between organs, acts as a precursor to neurotransmitter synthesis, nucleotide and nucleic acid synthesis for glutathione production, and for glucose metabolism. L-glutamine supplementation is mostly talked about in the athletic and bodybuilding circles for its effect on the human growth hormone and muscle recovery after a workout, but L-glutamine is largely ignored by the nootropics community despite all its benefits. L-glutamine is a precursor to the excitatory amino acid and neurotransmitter glutamate and aspartate, and the inhibitory amino acid and neurotransmitter GABA, affecting alertness, concentration, focus, memory, and mood. L-glutamine helps to boost your body's immune response, increasing antibodies to fight against viruses and bacteria. It also helps to tame inflammatory cytokines, and L-glutamine detoxifies the brain from excess ammonia, and it converts it into other amino acids, sugars, and urea. L-glutamine supplies energy to immune and intestinal cells. Not enough glutamine and these cells become sluggish and they can't perform properly. Supplementary L-glutamine is especially important during times of stress, tension, and physical strain. L-glutamine is an essential amino acid and a precursor for the production of glutamate. Glutamate is the most abundant neurotransmitter in your brain. As an excitatory neurotransmitter, glutamate is released from presynaptic cells, and then it binds to postsynaptic cells, inducing activation. Too much glutamine and neurons become overactive, causing a toxic environment that's harmful to neurons and to cognition. To keep this process in check, glutamate is also a precursor to the inhibitory neurotransmitter GABA. GABA works by preventing neural signaling in overexcited neurons caused by glutamate that could result in anxiety and depression. The balance of glutamine and glutamate has been identified in an array of brain conditions, such as mental illness, tumor, and neurodegeneration, as well as in normal brain function. The precursor relationship between glutamine and glutamate or GABA is often referred to in scientific and research circles. Glutamine is naturally synthesized from glutamate and ammonia in brain cells called astrocytes in a reaction that's catalyzed by glutamine synthase. Newly synthesized glutamine is transferred by neurons and it's hydrolyzed by phosphate-activated glutaminase to then produce glutamate, a portion which may be decarboxylated to GABA or transaminated to aspartate. Glutamate, the excitatory neurotransmitter, and GABA, the calming neurotransmitter, rely on this cycle to maintain homeostasis or balance within your brain. Glutamine also modulates the synthesis of nitric oxide by controlling the supply of its precursor arginine. When this cycle gets out of whack, things start to break down. The results can be particularly nasty and result in conditions like epilepsy or hepatic encephalopathy, which affects behavior, mood, speech, sleep, and the way that you move. L-glutamine becomes a conditionally essential amino acid when your body can't produce enough of it on its own, and then you need to replenish the L-glutamine levels either through supplementation or food. L-glutamine can be found in foods like beef, pork, fish, eggs, milk, wheat, cabbage, and others. L-glutamine is critical for an optimized brain. It's a precursor to the neurotransmitter glutamate. The balance of glutamine and glutamate is crucial to an optimized and healthy brain. The normal cycling of glutamine and glutamate takes a huge amount of energy. Research has estimated that the glutamate-glutamine cycle accounts for more than 80% of the cerebral glucose consumption. So when you're using nootropics like resveratrol or PQQ to boost mental energy, much of that energy is going towards maintaining the glutamine-glutamate cycle. A disruption of this cycle results in all kinds of problems, including Reye's syndrome, epilepsy, bipolar disorder, schizophrenia, anxiety, depression, and alcohol addiction. One Korean study measured glutamate and glutamine concentrations in the prefrontal cortex of mice who were infused with an astrocyte toxin, and they used other inhibitors to disrupt the glutamine-glutamate cycle. Glutamate and glutamine levels decreased on the 5th day in the mice. The animals experienced immobility and a decreased preference for sugar, a sure indication of mice in depression. A direct infusion of L-glutamine completely reversed all the impairment that was originally induced in the animal, and the researchers concluded that neuronal deficiency of L-glutamine causes depression. Researchers have long been on the hunt to determine what causes the human brain to age. Recently, mitochondrial dysfunction has been implicated in the loss of brain function in neurodegenerative diseases and aging, leading to an abnormal increase in the excitatory neurotransmitter glutamate. A study at the New York University School of Medicine used 28 patients with mild traumatic brain injury and 22 matched controls. Grey and white matter in the brain was measured using MRIs. The study found that 1 year after the traumatic brain injury, there was a significant global brain atrophy, much larger than in control subjects. The team noted the amount of brain damage from just one concussion, and that this type of injury was not exclusive to a severe blow to the head. Even mild injuries could cause brain damage. Most of the damage was associated with a disrupted glutamate-glutamine cycle and an abnormal increase in glutamate levels. Low levels of L-glutamine are associated with a variety of health problems. Cellular energy drops and the immune system weakens. Short and long-term memory declines. There can be anxiety, insomnia, and a lack of concentration. There can be muscle spasms, hypertension, convulsions, Tourette syndrome, and epilepsy. Ammonia levels rise in the brain. There can be poor digestion, bloating, flatulence, and constipation. When your neurotransmitters, including L-glutamine and glutamate, are in balance, you feel motivated, productive, and energetic, and you feel calm and relaxed during your downtime. When L-glutamine levels are low, you feel filled with dread. You're constantly worried, you have racing thoughts, and you're frequently late and disorganized. Many people in this L-glutamine slump resort to high carbohydrate foods and drugs or alcohol to relax. The amino acid L-glutamine is the precursor to L-glutamate production in the body. L-glutamate gets converted to GABA. L-glutamine improves concentration and focus. Glutamate is your body's most abundant excitatory neurotransmitter, and it's responsible for attention span, brain energy, learning ability, memory, and staying awake. An enzyme called glutamate decarboxylase converts the glutamate to GABA. It does this with the help of the active form of the vitamin B6, pyridoxal 5-phosphate, or P5P as it's known. The amino acid taurine helps to increase the communication and the productivity of this enzyme, and zinc helps the release of GABA from its receptors. When this glutamate-glutamine GABA cycle works efficiently, you feel relaxed with no stress or feelings of anxiety. Detoxification of your liver results in a more restful night's sleep. Focus, concentration, memory, and mood all improve. During times of chronic, long-term stress, that's caused by physical exertion or illness, glutamine levels in your body can drop by 50% or more. Supplementing with L-glutamine can improve your quality of life, increase energy levels, reduce muscle aches, improve digestion and gut health, improve quality of sleep, and reduce pain and fatigue. When you balance L-glutamine levels in your brain, you feel relaxed and calm. Cravings for food, sugar, and alcohol will decline. L-glutamine will help in recovery from workouts and improve performance. You may find it easier to lose weight. Many users take glutamine to help heal a leaky gut syndrome and to reduce the symptoms of Crohn's and celiac disease. For the brain, L-glutamine can help to improve alertness, concentration, focus, memory, and mood. L-glutamine was identified as a neurotransmitter several decades ago, and there's been a lot of research on L-glutamine published since, but most of it focused on strength training and maintaining muscle mass in athletes and for people healing from surgery or recovering from illness. But L-glutamine can be a powerful nootropic also. There's a couple of studies looking at the glutamine in the brain. L-glutamine increases human growth hormone. Bodybuilders and athletes use supplementary L-glutamine to help to repair and build muscle, and there's several studies supporting the notion that L-glutamine increases human growth hormone. In one study, researchers worked with 9 healthy subjects and gave them 2 grams of L-glutamine in a cola drink. Blood samples were taken before drinking the cola spiked drink, and then again 30 minutes, 60 minutes, and 90 minutes later. The researchers found that both L-glutamine and human growth hormone levels were significantly higher than before taking the L-glutamine. The team concluded that a surprisingly small oral glutamine load was capable of elevating human growth hormone. Human growth hormone and brain-derived nootropic factor are intricately linked. Brain-derived nootropic factor is involved in long-term potentiation and the encoding of long-term memories. Lack of concentration and poor memory can be improved by supplementing with L-glutamine with vitamin B3 or niacin. Some of the glutamine in your body is transformed into glutamic acid in your brain. Glutamic acid functions first as a fuel, but it also gets rid of excess ammonia by binding to the cellular toxins and converting it into glutamine. There was a randomized, double-blind, placebo-controlled trial with 42 healthy men and women aged 40 to 76 years. The subjects received a 5-gram stack containing glycine, L-glutamine, and niacin twice daily for 3 weeks. The L-glutamine stack increased human growth hormone by 70% when compared to placebo. But surprising, it wasn't the growth hormone that improved the memory and the vigor. It was the insulin-like growth factor that improved the memory and the vigor, attributed to the L-glutamine stack that the subjects were taking. Most people don't get enough L-glutamine from food alone, and this is why adding L-glutamine to your diet can boost your immune system, improve your ability to fight infections and diseases, and boost your cognition. Recommended daily dose of L-glutamine is 2 to 5 grams per day. Serious athletes often dose up to 10 grams of L-glutamine per day. L-glutamine is considered very safe when it's taken in normal recommended doses. Rarely do people report side effects like nausea, vomiting, flatulence, abdominal pain, constipation, dry mouth, hemorrhoids, dizziness, depression, skin rashes, insomnia, and increased sweating. Remember, the balance between L-glutamine and glutamate is critical for the optimal health. Some recent research has shown that L-glutamine can stimulate tumor growth, so if you're dealing with any form of cancer, you should avoid L-glutamine. And if you're dealing with cirrhosis of the liver, you should also avoid L-glutamine. If you have severe liver disease that includes difficulty thinking or confusion, or hepatic encephalopathy, don't use L-glutamine. If you're allergic or sensitive to MSG, you may also be sensitive to L-glutamine because your body can convert it into glutamate. And if you've got a severe mental health disorder, including mania, or you frequently have seizures, you might also want to avoid L-glutamine. If you're dealing with illness, recovery from surgery, strenuous physical activity like a workout, leaky gut syndrome, Crohn's or celiac disease, and need some help in recovery, L-glutamine might benefit you. L-glutamine also helps to curb the desire for sugar, carbohydrate, and alcohol. It's suggested trying an L-glutamine supplement first at a small dose of 500 milligrams to see how you react, and you can safely dose up to 20 grams of L-glutamine per day. But most users find that a smaller dose of 5 grams per day is sufficient for boosting cognition, memory, and mood.